So you're thinking about getting your nipples pierced and you have inverted nipples. Coming up next, I'm going to tell you what you need to know beforehand in Consultations by a Piercer, episode number 42. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding it helpful and useful and all that stuff. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Now, this is not the most common issue in the world. It's a lot more common than I once thought it was. The first time I encountered inverted nipples, it was a complete surprise to me. I didn't know they existed. It was on a partner, and she was very self-conscious about it. The thing with these is that in some cases, piercing them will cause the nipple to be more erect on a regular basis and kind of pull them out of the body and keep them there. This is definitely a piercing that can help improve your body image and self-esteem, especially if you're very self-conscious about it. Now, there's 3 grades of inverted nipples. The first one is grade 1, where the nipple can be pulled out. It takes a little extra work. Sometimes it'll stay out for a while with stimulation. Usually not a big issue, just kind of more bashful, I guess, than anything else. But it generally will go back fairly quickly. Second one is the nipple kind of becomes erect fairly easily, but immediately will go right back to being not erect anymore. Just kind of sinks right back in the body. The third grade is possibly the most drastic, and that's where they won't come out pretty much at all. There may be a milk duct connected in the center. It kind of happened during your development as a human being. For one reason or another, your body decided to do this instead of the way everything else is. In that case, if it's really severe and you just can't even get it out in the first place and get it to the point where it's erect, it's probably not pierceable. And you can get corrected surgery if it is connected to have that removed. But it is the most difficult to deal with as far as piercing. Some are, and everybody's kind of, it's not cookie cutter. Everybody's kind of on a spectrum between each one of these. Some are more severe than others. Like I've had grade 2 that are almost grade 3, but weren't an issue to pierce and heal out. So just because you think you might be in one of these, don't give up hope. You know, there is possibility that piercings can help you. The last one I want to talk about is underdeveloped or non-developed nipples. These are ones that just didn't form. Sometimes, depending on the size, if there's enough tissue there, they can be pierced. They are not inverted. Inverted is a kind of different thing. The worst case of inverted, it's almost like it caves inward instead of even being out. Now let's get into the meat of it. Average healing time on these, just like a regular nipple, is going to be anywhere from 6 months to a year, during which time I'm going to suggest cleaning twice daily using a sterile saline solution. Personally, I like NeoMed's Piercing Aftercare because it comes out in a fine mist. However, there are other things on the market that will work. One of the main things you want to look for is that it is in a pressurized can. It says sterile on that can. And when you turn it over and look at the ingredients, it says sodium chloride in distilled water. Salt and water. Nothing else, no preservatives, nothing. Now, how you apply it depends on how it delivers. Like I said, with the Piercing Aftercare, it comes out in a fine mist. It makes it fairly easy. Just mist it, leave it alone. A lot of the other ones, including NeoMed's Wound Wash, it comes out like a squirt gun, and that isn't going to feel particularly great, and it's going to be wasteful. So what I'll suggest doing in that case is compresses. Take a sterile piece of gauze sponge or a clean paper towel, saturate it, lay it against the area. In both cases, you want to leave the saline on there for a minimum of 5 minutes and then pat it dry. The only other thing I suggest doing, and this you could do just once a day, so at the end of your shower, stick your chest out like you're proud and let the water flow over the area for about 30 seconds. What we're doing with these two things is we're removing that discharge that your body produces during the healing process that'll harden and crust on the jewelry, often referred to as the crusties. This is usually enough to completely remove it, and the main reason we want it off there is movement can agitate the piercing. Also, it's uncomfortable when it moves through the piercing, those speed bumps. So if you have a situation where you don't seem to be able to get it off, or that's not going to be enough to get that discharge off, go see your piercer. Have them clean it for you. Don't go to the medicine cabinet and start pulling out everything that's tipped in cotton or has a sharp edge. You're probably going to cause more issues than good. Cross-contamination prevention, common sense stuff. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on, near, around the piercing until it heals. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis. Do not swim. I know you're going to see conflicting views on the internet on this whole subject, but the reality is whenever you can submerge your whole body in a body of water and move around, there's going to be microorganisms in that body of water, and they're going to have direct contact with that open wound, which could lead to an infection. The other issue is with treated pools. A lot of times those chemicals can cause issues also. So understand, it's best to stay out of the water until they're both completely healed. Keep pets away from it. Everybody looks at me weird when I say this. Like they think that I'm gonna I think their dog and them are doing things they shouldn't. What I'm talking about is in the bed mainly. Don't let them sleep in the bed with you, especially under the covers. You don't realize how many things your body comes, or your dog, pet, cat, whatever, comes in contact with, and how easy it is for that to transfer to your bedding and then transfer to the piercing. Trauma, clothing, and abuse. Do not sleep on the piercings. Make sure you're sleeping on the other side of your back. Do not spin, rotate, or move the jewelry. Do not play with the piercings. Do not let anybody else play with them. Leave them alone. They are the forbidden zone. Now, for the first 2 weeks, you want to wear something that limits movement, especially when you're sleeping. This varies from person to person because you're all shaped different. More common, or what most people go with, is sports bras, men's A-shirts, tank tops, tube tops, anything that has kind of even support. But for you, that may not work. So experiment and see what works best for you. One of the things I always try to tell clients when they come in is you don't realize how much your nipples come in contact with things until you have your nipples pierced. It is hard to avoid contact with all kinds of things, including seatbelts and etc. So be very conscious of it at first, and every time you bump it, your body's kind of training you to keep things away from it. And the reason why is that contact and abuse to the area will prolong your healing period and increase the likelihood of problems. So isolating the piercings is always important, regardless of the piercings. But this one, it can be a little difficult to kind of train yourself at first, and they tend to be tender to the touch much longer than other piercings. Now, let's talk about risks. The biggest risk with this, of course, is rejection and migration. Rejection is where your body completely rejects the jewelry. It grows completely out. Migration is where it shifts and moves a little bit. Most common thing we see with this, with inverted nipples, depending on the severity of the invert, is the nipple kind of splits itself in two when it's not erect. So basically, it'll migrate through that. You'll end up with a piercing on one side of the nipple, and then it's out of the nipple, and then it's pierced on the other side of the nipple. This is one of the reasons why it's very important to find somebody that's experienced with this, with piercing inverted nipples, because if it's folded during the process, this will pretty much happen every time. I'll go a little bit into that later on. The other thing is basically check those balls and ends on a regular basis. Nothing sucks more than getting a piercing, going through the process of that, and starting the healing process. And then one day you don't check the balls, or 1 week you don't check the balls, they come unscrewed and you lose the piercing. Now, the other risk is closure. Nipple piercings are notorious. It doesn't matter how long you've had them, that if you take the jewelry out and leave it out for even sometimes a day or two, the piercing holes will start to close. It's really a piercing, you need to leave something in it. Now let's talk a little bit about placement and angle. This piercing should be done at the base of the nipple, not into the areola, that darkened area around the nipple. It should be basically just through nipple tissue. The main reason for this is to avoid contact with milk ducts, but also it can kind of make for a much more difficult and traumatic heal if you go behind the nipple, especially if you have female anatomy. Now, the nipple should be marked when it's erect, and it should be done with you standing. The idea is we try to make them look as horizontal as possible and matching. Reality is your body isn't shaped like that, so it's more of trying to give it that illusion of looking like they're matching, but usually we pierce to the anatomy more so than actually trying to get them perfect. But they should look perfect. When you're getting marked, always stay at attention, which means arms by your side, feet together, looking straight forward. Not looking down while the person's marking, because that will distort where that placement is. Now, if your nipples are very bashful and are not very easy to get erect, it's not a bad idea to bring along one of the pumps. They basically kind of look like a bicorn, you know, with the squeezy thing in the back, and they have kind of a cone shape bell that sits over the nipple, and then it sucks the air out, which will cause your nipple to become inflamed and fill in with blood and become erect. Sometimes it's a little easier than, because you need to mark them. You're probably a little nervous about the whole procedure. You're dealing with someone that you're not normally in that position with, so you may have a little bit of issues getting the piercing area erect and in the position that needs to be in to get marked and to get pierced. Bringing along one of these could be very helpful in that case, and I personally don't like the idea of studios having their own. It creates a whole new thing of trying to keep things sterile, and usually because these are made of plastic, there isn't really a lot of options. So it's usually best if you bring in your own personal device. You can find them online. Also, most good adult stores, which I'm happy to say are not as creepy as they once were. There's actually some nice ones out there that make you feel comfortable. You might want to explore them. They should know what you need and bring it along to the appointment. You may or may not use it. Who knows? Now let's talk about jewelry. This piercing should always be done with a straight barbell, not curved, not circular, and not rings. All those other types are going to increase the likelihood of rejection, which is already a problem when it comes to inverted nipples. So always a standard straight barbell, preferably made of titanium and internally threaded. The jewelry should match the size of your nipple, meaning that it should be a little bit oversized to allow for inflammation. Nipples will tend to swell a little bit, so you always want them to be loose, not super tight to both sides, because that can cause issues. Now, the jewelry can be threaded or threadless. It really depends on your preference and what style jewelry you're getting. The only disadvantage of threadless jewelry would be that it's not quite as secure as threaded, but it doesn't have that problem of constantly having to check how tight it is, that it's screwed on tight. So they both have their own advantages and disadvantages. The only thing I would say with threadless is if you have ends that have sharp edges, points, or things that are going to catch on clothing, they may not be the best option. Because we pierce with longer barbells, you do want to downsize to shorter ones in roughly about 2 to 3 months. This is especially the case if you feel like it's getting caught on jewelry, or for one reason or another is creating that leverage point where one end will be against the outside, and because of pressure of clothing forces it almost to put pressure on the nipple. So if it's uncomfortable or you're having issues with it, see your piercer to have them downsized sooner than that, but definitely within 2 to 3 months. Now let's talk about pain in the piercing experience. Everybody's a little different, but I most commonly hear between a 3 and a 6 on a scale of 1 to 10. 10 being the worst pain they've ever experienced with these particular piercings. The other thing is the second one tends to be a little bit more than the first one. That varies. I've had a few people that say that isn't the case, but it's pretty common. A breathing exercise can make the piercing experience a lot better. Usually what I suggest is an inhale and exhale, inhaling through your nose and exhaling through your mouth. You know, smell the cake, blow out the candles. It does help to kind of get you in a more relaxed state. The other thing is everybody wants to close their eyes like they're scared, like a train's coming at them or something. The reality is you're not going to be able to see what the piercer's probably doing anyway. Closing your eyes tends to heighten your other senses, including pain. So it's usually best just to kind of relax, keep your eyes open, and just go with the flow. It'll be over and done with before you know it. Now, I strongly advise doing this particular piercing with forceps. You could possibly do them freehand, but the reality is part of the most important part of getting this piercing done is that tissue is held in exact shape. It compressed and held in place. Otherwise, if that isn't, and the nipple starts to recede back in the body, you're not going to get that jewelry to where it needs to be, and that the placement's going to be totally off. Now, the first thing we do is, of course, disinfect the area, and then have you stand up to mark it. Then we'll put you in a reclined position. Next, take those forceps and clamp down the tissue so it's compressed, making sure that the nipple is not folded in the center. Like I mentioned earlier, this could be an issue with inverted nipples where there's so much pressure on the center of it, it pulls downward. And if you do not have that tissue evenly anchored in there, it can cause issues in the future, especially with rejection or migration. Next, the needle is pushed through while you do the breathing exercise. The forceps are taken off. Jewelry is inserted with a guide pin. Guide pin's taken off, needle's out of the body, of course, and then the ends are put on. A little bit of saline. Congratulations, your nipple's pierced. Afterwards, you might notice a little bit of slight bleeding off and on for a few minutes. Also, a little bit of throbbing and aching pain. That'll usually last 3 to 5 minutes. It varies from person to person. Then it's definitely going to be tender to the touch after that. Let's talk a little bit about anatomy, because it's very important with this, and judging how... doing a consultation with a piercer's experience and judging what your anatomy is capable of. The piercing area needs to be erect at some point. There needs to be enough tissue there to make sure that the jewelry can be fully secured in there without an issue. And that varies so greatly from person to person. If you're going into a consultation beforehand, the nipple sucker things, I would suggest bringing them with you, even if you're not getting pierced that day, just to give the piercer a complete understanding of what your nipples look like when they are erect. What to consider: make sure that your piercer has experience with doing inverted nipples. It's not really something that a lot of piercers have done. Oftentimes, they just will say, nope, I'm not comfortable doing it. Some, they've done numerous of them over the years, and they feel completely comfortable with judging your anatomy and doing the piercings. Good idea to go in for a consultation ahead of time. Have them evaluate your anatomy and talk to them about whether or not you're a good candidate or not. You may be able to get pierced that day, or you may be able to schedule an appointment for a later time. You don't, this is a misconception. You don't have to definitely get pierced the day you visit a piercing studio. Even if you have to set up an appointment just to have a consultation, you don't have to be pierced that day. It's important to get to know your piercer and find somebody you feel comfortable with that has the knowledge that you need to get this done correctly. Depending on how nervous you are about pain, etc., you can do these one at a time. There's no reason why you have to do both of them in the same sitting. The nice thing about doing both of them in the same sitting is you only go through the healing process once, and it's over and done with. But you can stage them out over a period of time if you feel more comfortable doing that. I mentioned this earlier, but they are like curb fillers. They bump into absolutely everything. Pay attention to what they're bumping into and avoid that in the future. Learn from the experience. Your body's telling you things. Don't just keep doing whatever you're doing and hurting yourself and thinking, oh, eventually this won't hurt, because there's probably a reason why your body doesn't want you to do that particular thing. Downsizing, once again, it's important to downsize those shorter barbell, especially with these, because leaving the longer jewelry in there just increases the likelihood of trauma. It increases the likelihood of them getting caught. It increases the likelihood of rejection and migration. So it's best to downsize as soon as possible. Lastly, plan ahead. If you're going on vacation, it is best to wait until you get back. Number of reasons for this, including you will have no control over how clean the environment is that you're going to be staying in. You may be exposed to pathogens or microorganisms that you're normally not exposed to and have not built up an immunity for, so you have an increased likelihood of infection. Also, if you're on vacation, most people like to swim. So it's best to wait until after the vacation, then get them pierced, or postpone the vacation. Same thing with business travel and everything else. It's usually best if you have a long period of time where you can stay at home and recuperate and heal the thing properly, because that's the whole point, right? Well, that's all I have to say today. Anybody has any experience with inverted nipples and getting them pierced, please comment, share your experiences. You'll help others. Till next time, here's hoping you'll leave piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.